Assalamu alaikum. Now I start my talk. Thank Dr. Mazen for your invitation to be here. I wish you see everything is okay now. Okay? Everything is okay? Okay. Now I start my talk. I speak about today my topic. It's facelift surgery. Facelift surgery is considered a complementary part from the facial aesthetics. My name is Kassem. I am oral maxillofacial surgeon. I don't have any conflict of interest regarding this issue. My topic about its 5 points. I speak about the history of the facelift and the facial aging and surgical anatomy. It's very important, very crucial. And how we can do the patient assessment and patient selections, surgical protocol, and finally the philosophy and conclusion take-home message. See this lady? What do you think about this lady? This lady, she's so happy. This is during a facelift, and see, this is during the surgery. Now we can perform, see how we can carry the flap. This is done after a 100-year journey of surgery to get these results. The story started from this gentleman. He's doing the parotid surgery and he's elevating the mass. And then they try to publish in an article how they can stretching the skin for cosmetic reasons, like this. And it's followed by the development of the anatomy and the study of the spas, the study of the ligaments, and all these things. Regarding to the facial aging, it's very crucial to understand this. The aging starts from the beautiful glass of wine like this. It's very recent, and the old like pyramids, starting from wrinkles, drooping of the brow, hollowing of the eye, downward of the mouth angle, and nasolabial folds. Regarding to the drooping over the eyelid and this drooping of the cheek, the chin become weak, and what we call this jewel, and drooping of the neckline and turkey necks. The aim of our surgery is to get a more visible upper eyelid. This is very important. This can be done by the blepharoplasty, and this is one done concomitant with the facelift. Also, we do the lifting of the cheeks and get the strong chin and useful neckline. This end was smoothing of the jawline. Let's see the patient from the anterior. I see the patient from the anterior. It's drooping of the over eyelid and drooping of the cheek and jewel. We can get something, it's called honeymoon effect, by asking the patient to hold the mirror, then leaning in his backs. The patient will see the results. From this to this. Okay, this is exactly what happened by aging. Most probably our aim when we are doing a facelifting is to treat the gravitational or mechanical aging. We are not dealing with biology. We can do this using hyaluronic acid or other filling, and or doing the same sitting fat graft like this. You see this aging in the lips, what we call this barcode or smoker's lines, and this ligament become relaxed and the skin followed by skin sag. This is exactly what happened during the aging. So understanding the anatomy and understanding the position of the skin, it's very, very crucial to get a proper treatment plan for the patients. Okay, we see this aging, and this is how the fat it resorbed in the face. It's very important to understand these fats. All this, it's above the muscle. So your work most probably must be above the muscle. So it's advice not to do Botox with these procedures. Okay, let's see the aging in the upper face and mid face and lower face. see the upper face and mid face and lower face, starting from the bone, muscle, soft tissue, and finally the skin. If we start on the upper face, we see that there are drooping in the eyebrow and temporal hollow, and also the aging affecting the bone, getting a temporal hollow with diagnostic of aging, and the brow become slightly downward. Regarding to the muscle aging, we will have a forehead line, thinker's lines. We have the crow feet and the frowns, and the mincing effect by the effect of the muscles. This exact aging for the face. Regarding to the mid face, we have it affect the projection of the zygoma going downward, and soft tissue, obvious soft tissue volume. This is mechanism of aging. It's very important. We have to know that aging, it can be intrinsic and extrinsic. It can be mechanical aging or deterioration of photoaging or deflation of loss of the collagens. This, the effect of gravity, UV, smoking, all this affect the aging. Most probably we are dealing with the gravity and this. We like to transfer this exact what happened in aging. Also, photoaging, it's very, very important, starting from fine lines, rhytids, and separokeratosis, and hyaluronic acid degradations. Develop these bad faces. This is collagen wrinkles, and this is epidermal cell and separokeratosis. If we see the aging happening in this area starting, followed by the upper eyelid and this side, and going to the lips. This is what we call this jewel. And this is finally accordion phenomena. Our aim when we treat the case is to restore this beautiful black triangle, this triangle, and its apex, it's downward. So this is the aim of the treatments in our patients. See the developed nasolabial fold, followed by sagging the marionette and the cheek hollow. And regarding to the lower eyelid, and this what we call this pre-jeweled sulcus, and oral commissures and marionette. Okay, the aging is different between the male and female. See in the male, the chin projections, the downward commissures, the downward of the eyebrow, nasolabials. Regarding to the lady, you see the aging pattern. The aging pattern, it's folds smoothly by aging, and then it will go in the monoposal to be very aggressive aging. Patient assessment. In this surgical facelift, the classic surgical facelifting, we are following the Langer's line to avoid obvious scar. We try to hide our incision, starting from pre-auricular incision with temporal extension, followed by post-auricular incisions. And after this, we remove the excess skin, and we remove the part. We make the application for the mask and close it. This is a classic facelifting. We do a deep lifting of the jaw, and this is classic facelifting. Like this case, we can do this work by opening surgery, or we can do this by some what we call this thread lifting. Like this case, we ask the patient to hold the mirror and lean out to see the effect. This is the elastic, and this is the way and the direction of plications. If you see the direction of plications, most probably it's against the gravity. This is how we can put our incisions, and how we can make this section to this mass, and then application from the neck to get a good result after the patients. Okay, let's start the surgical protocol. I start with thread lifting, followed by mid-face lifting, and then the total face and neck lifting. Okay, this is a thread face lifting. I think Botox or filler are great, but in a lot of cases they are not enough to restore it. This case before, and this is how we can reach to this. I prefer to use these silhouette sutures. We can make soft tissue suspension, and we can make slight volumetric change of the facial tissue, and also it will enhance the neovascular formations. Aging skin can cause most probably from the gravitational pull and soft tissue sag, and also facial tissue collagen depletions. All this, it can be treated by these aggressive sutures. This is a histology, and this suture lifting, it will enhance more new collagenase, like this case. Before we start, we have to mark our patient. I prefer to use surgical markers, autoclavable surgical markers. I will make my first line inside the hair, and I follow Langer's line to avoid any scar, and I put my points. Using this point, I will insert the sutures, and I will stretch it, and the result will last up to 2 years. And later on, you can, after 2 years or 3 years, you can make retightening of this suturing. This can treat the mentolabial fold, like this. Also, to help to can make jawline definition. This procedure is FDA approved? Yes. The procedures, we are giving the patient IV antibiotic, and I take the pictures and I mark the area. I give the patient mixtures of local anesthesia, the local anesthesia with adrenaline, and I make my micro incisions in the hairline. Then I place my threads, and I make anchorage and stretching the threads, and then I close it using absorbable sutures, and I give the topical anesthetic cream, and the patient can drive safely to his home. Let's start from the surgery. We are giving the patient anesthesia, and the anesthesia at the temporal incisions and in the sutures line. You're giving anesthesia along the suture position. I give it according to the along the suture position. Then I make my temporal incisions, and then I insert my meshwork, and then I stretch it like this. I will show you later in video how we can do this in full details. See this, how it can stretch the sagged skin. Here, the entrance. This is coronal sections, show us how we can placate it. And this, we stretch it like this. This will get smaller face and more young and more useful face. And then you remove the excess. Maybe we have possible complication like suture ruptures, hematomas, skin ribblings, skin eye indentations, and temporal area pain in some patients. Like this. You can just make squeezing to this. This before release, and after release you will get these plications. And this, after you finish, you fix sutures, you will cut it, and then you will go. This exact the surgical procedures. We mark it like this. And I see now the sag of the skin. I make my marking. I prefer to make my marking when the patient is sitting position to see the exact problem of the patient. This is how we can mark it exactly. And after I mark I will make sterilization for the area. It's very important, and it's very important to confirm that your patient's clear from any infections before you start to do anything. You're giving the patient anesthesia in the temporal and along the suture. It's very, very important. And we are giving this anesthesia with adrenaline. You make a proper topical antibiotics. Then we are measure the suture. I use it for the patients. And after this, I will cut it to appropriate length. I make the temporal incisions inside the hairline, and I follow the Langer's line to avoid scar for the patient. Then I make a tiny dissections like this. I enter the right plan, and you find your plan is very clear to do the proper dissections. You do blunt dissection using sharp scissors. Then you will pass this. You will pass the sutures like this. And it's very important to use your finger to clear the pass during the incision. You remove the part from this sutures, this cannula. Now you just cutting like this. And after this, you are lifting, you are using the suture for lifting. This is after lifting. You stretch it. And this motion is very important to exclude and remove any hematomas. And then you close the sutures. And I advise my patient to put some mask and take anti-edematous medication. We can do this simultaneously using with infusion of the fats to get this result. It's an easy procedure if you can do it safely without complications. Solo wheat. Okay, and after 3 years, maybe it need more tightening for this. It may need just your apron temporal and make tightening for correct asymmetry or to get a better result. Just open an incisions and take the sutures. Make more tightening like this guy. You improve your result. This is another technique. This is pure surgical. In this patient, we are opening subciliary incisions, and with slight extension, the extension becomes slightly downward. We do this extension downward to avoid any hematoma later on. And see, we are going for this section, and we stretch the skin upward. And after this, we are removing the excess skin and stretch it like this. And after this, you are closing in one layer. See how we can remove the excess skin and we get a perfect result. The last thing is surgical facelift. We are cutting by this way to remove the excess skin. See how? And this is the extent of our dissection. We cannot go below this to avoid any nerve affections. This is how we can remove the excess skin. And this can be done, it's better to done with local anesthesia. Okay, we do this section of all this, and we are doing a neck extension also. We make plication and stretching of this mass like this. We're stretching this mass, and it's preferred to do blepharoplasty in the same sessions. This is the way how we can stretch it. And we are going back to dissect in this area. And we remove the excess skin and close it like this. The end, we have the conclusion. You have to study the anatomy first and second last. Nothing is better than proper training. And my advice, think local, think local, think local. And it's very important. You have to advise your patient about the social lag. Maybe the patient develop hematoma later on. So it's very important to take care of this. Thank you for your time, and I'm so sorry for being late. Thank you, Dr. Mazen, for your support. I wish you a happy day. Thank you so much for your time.